The silent colon condition affecting 1 in 3 adults over 60. I am Dr. Lee, MD. What if I told you that millions of adults are walking around with a condition inside their colon right now, and they have absolutely no idea it's there? No pain, no symptoms, no warning signs, nothing. Yet this same condition can suddenly lead to severe abdominal pain, infection, hospitalization, emergency surgery, and in some cases, life-threatening complications. And here's the shocking part. By age 60, approximately 1 out of every 3 adults has it. At age 80, nearly half of all adults have it. That means that if you're watching this and you're over 60 years old, the odds are surprisingly high that either you have this condition right now or you may develop it in the future. Most people develop it, and discover it by accident. They go into a routine colonoscopy. The procedure goes well. Everything seems fine. Then the doctor says, "You have diverticulosis." And that's it. The appointment ends. No explanation, no discussion, no clear answers. Patients leave wondering, what is diverticulosis? Should I be worried? Can it become dangerous? Can it turn into cancer? What foods should I avoid? And why didn't anyone explain this to me? Today, I'm going to answer all of those questions. But stay with me, because one of the biggest things doctors told patients for decades about diverticulosis turns out to be largely wrong. And later in this video, I'm going to show you what researchers discovered when they studied nuts, seeds, popcorn, and diverticulitis. The results surprised many doctors. We'll also cover the difference between diverticulosis and diverticulitis, the warning signs that should never be ignored, why people live their entire lives with diverticulosis and never have a problem, the habits that may help protect your colon as you age, and the one symptom that often appears before many people realize they're developing diverticulitis. Hi, I'm Dr. Lee. I've spent decades caring for patients with digestive diseases and performing tens of thousands of GI procedures, including colonoscopies. And today I'm going to help you understand one of the most common and misunderstood conditions affecting older adults. Let's start with what diverticulosis actually is. Imagine your colon as a long, flexible garden hose. When you're young, the walls of that hose are strong and resilient. But as we age, certain areas can gradually weaken. Over many years, the colon pushes outward against these weaker spots. Eventually, small pouches begin to form, almost like tiny balloons pushing outward through weak areas in a tire-like tube, the colon. These pouches are called diverticula. When a person has these pouches, the condition is called diverticulosis. Now, this part is extremely important because most people think diverticulosis and diverticulitis are the same thing. They are not. In fact, one small word changes everything. Think of diverticulosis as simply having the pouches. They're present. They're sitting quietly inside the colon. Most people feel absolutely nothing, no pain, no symptoms, no warning signs. In fact, many people will live their entire lives with diverticulosis and never know it. Now let's add 3 letters. ITIS, diverticulitis. In medicine, itis means inflammation. Arthritis means inflamed joints. Bronchitis means inflamed airways. Tonsillitis means inflamed tonsils. And diverticulitis means one or more of those pouches has become inflamed or infected. That's when the trouble begins. Think of it this way. Diverticulosis is having a pothole in the road. Diverticulitis is when that pothole suddenly turns into a major traffic accident. One is a condition, The other is a complication. And that's very important as a distinction. Here's some good news. Most people with diverticulosis never develop diverticulitis. Let me say that again. Most people with diverticulosis never develop diverticulitis. Unfortunately, when diverticulitis does occur, the symptoms can develop surprisingly fast. And many patients mistake the early symptoms for something much less serious, like gas, constipation, indigestion, food poisoning, or simply getting older. I remember one patient who came to my office convinced she had food poisoning. She had developed mild discomfort in the lower left side of her abdomen. Nothing severe, at least not at first. She figured it would pass. Instead, the pain became worse. Then came a fever, then nausea, then loss of appetite. What she thought was food poisoning was actually diverticulitis. And that's a story I have seen many times over the years. Because the body often whispers before it screams. That's why understanding the warning signs matter so much. Now, before we talk about symptoms, let's discuss diverticulosis and why it becomes so common after age 60. The first reason is aging itself. Just as skin changes, joints change, muscles change, and the blood vessels change. The tissues within the colon change also. Over time, the wall of the colon becomes less resilient. Years of pressure from normal muscle contractions inside the colon contribute to these pouches themselves actually forming. Another major factor appears to be diet. Researchers have long observed that populations consuming high fiber diets tend to have lower rates of diverticular disease. Fiber acts almost like a sponge. It absorbs water, adds bulk to stool, and helps stool move through the colon more efficiently. Less straining, less pressure, less stress on the colon wall. A major study published in the journal Gastroenterology followed more than 47,000 men for 18 years. These researchers found that individuals consuming the highest amounts of dietary fiber had significantly lower rates of symptomatic diverticular disease than those who were consuming less or the least fiber. That's one reason fiber continues to be one of the most important recommendations for colon health. Now, here's where things get interesting. Because for decades, patients were told something that many still believe today. Avoid nuts, avoid seeds, avoid popcorn, avoid strawberries, avoid anything with small particles. The theory was that these foods could become trapped inside diverticula and trigger diverticulitis. It sounded logical. The problem, though, the evidence never supported it. Then researchers studied the issue more carefully. And what they found surprised many physicians. Large studies failed to demonstrate that nuts, seeds, or popcorn increase the risk of diverticulitis. In fact, some studies suggested these foods may actually be associated with a lower risk, meaning millions of people spent years avoiding foods that they likely never needed to fear. Now, that doesn't mean every food works for every person. If a particular food consistently causes symptoms, pay attention to your body. But on the old blanket warning about seeds and popcorn is no longer supported by research the way people think. So what symptoms should you watch for? This may be the most important section of this entire video. The most common symptom of diverticulitis is pain, usually located on the left lower side of the abdomen. The pain may start mild, then gradually worsen. Many patients describe it as persistent, constant, and different from ordinary gas pain. Other warning signs include fever, nausea, bloating, constipation, loss of appetite, and increasing abdominal tenderness. And here's something many people don't realize. Fever combined with abdominal pain is one of the biggest clues that something more serious may be happening. If abdominal pain is accompanied by fever, please don't ignore it. Call your healthcare provider or seek emergency medical attention. Now let's talk about what happens if diverticulitis becomes severe. Because while many cases respond well to treatment, complications can occur. An infected pouch can develop an abscess. The colon wall can
Within the
perforate,
sigmoid,
meaning a hole develops in the colon wall. In rare situations, emergency surgery may be required. That's why persistent, worsening abdominal pain should never be
diverticulitis,
ignored. Fortunately, there are several practical things you can do to support colon health. Eat more fiber-rich foods. Stay hydrated. Exercise regularly. Maintain a healthy weight. Avoid smoking. And stay current with recommended colon cancer screening. One question I hear frequently is, can diverticulosis turn into colon cancer? The answer is no. Diverticulosis does not become colon cancer. They are different conditions totally. However, both do become more common as we age, which is one reason colonoscopy remains so important. It can identify diverticulosis, but more importantly, it can find and remove precancerous polyps before they become cancer. Before we finish, let's quickly review the warning signs that should never be ignored. Persistent abdominal pain, pain that's getting worse instead of better, lower left abdominal pain, especially with tenderness, fever, nausea, vomiting, blood in the stool, or sudden changes in bowel habits. If you're experiencing these symptoms, seek medical attention. Don't try to tough it out. Don't assume it's nothing. Your colon works for you every single day. Usually it works for you without asking for attention. But when it does ask for attention, listen. Because some of the most serious conditions begin silently. If this video helped you understand diverticulosis and diverticulitis, let me know in the comments. Have you ever been told you have diverticulosis after a colonoscopy? I'd love to hear your experience. Make sure you're subscribed for more videos on digestive health, colon health, medications, healthy aging, and disease prevention. I'm Dr. Lee. Thanks for watching. God bless you, and I'll see you in the next video.